Art Hill and Outdoors is brought to you by Vortex, the force of optics, New Archery Products, Passion Drives Innovation, Northwoods Bear Products, Hoyt, Get Serious, Get Hoyt, Moultrie, Total Game Management, Ameristep, Innovation, Safety and Quality, Arctic Shield, Locks Heat In, Keeps Cold Out, Drake's Adventures. We get children involved. Also brought to you by these fine sponsors.
Hello, I'm Michelle Helin. As a registered nurse of 22 years and a CPR and first aid instructor for 11 of those, today I'd like to share with you some information about how to stay safe in the woods and how to be prepared for an emergency. As the fall season gets into full swing, one important consideration that I have, as well as Art, is that all of you are out there and you're hunting safe. Every year there are hunting accidents caused by many things, and nearly every time they could be prevented. Prevention is so important because it's way easier to prevent the problem to begin with than to try to deal with the aftermath. Those accidents are in the categories of shootings, so your gun safety. Follow the key cardinal rules of gun safety, and please always make sure that your gun is always pointed in a safe direction and you're not pointing it at anything you don't intend to shoot, and that you know your target and beyond. Another category of accidents in especially archery season, also in the gun deer season, are going to be your tree stand injuries, your falls. Please wear a safety harness at all times. Injuries can occur from falls as low as 6 feet off the ground. So please wear a harness. Full body harness is the safest compared to just a simple belt type harness. And be especially careful when you're going from that last step on the ladder onto your stand. And even better, use something like a lifeline type of harness that you can hook into at the base of the tree and have in place until you know, all the way up and through your hunt to eliminate that hazard. Another category of injuries that occur are bleeding injuries or puncture wounds that occur when we're gutting or cleaning our animals after we've harvested an animal. And that can be minimized, or that risk can be reduced by making sure that you're using the right equipment for the job. A lot of times those injuries occur when someone is using a simple knife or pocket knife, pocket style knife, or just a simple, gutting knife to try to cut or break the pelvic bone, and using a hammering effect like this, and then something slips, and before you know it, you got a knife in your femoral artery. So very dangerous situation anytime, and especially if you're on a remote hunt. So using the right equipment for the job, using a bone saw for that, a zip saw, something like that to get through that pelvic bone in a much, much safer way. So prevention, using the right equipment or the right gear for the job. Even with that, accidents can and do occur, and you want to be prepared for not only an accident or an injury, but also a situation where you may be lost or injured in the woods, and it's going to be some time before someone can come and get you. It seems overwhelming because there's so much gear you could have, and how much can you really fit in your backpack? How much are you going to really have with you? And obviously, if it's not with you and on your person, it's not going to do any good. It won't do any good if your gear is back in the pickup truck at the base of the mountain and you're up in the mountain lost. So to try, how do you wrap your brain around what of all this gear you could purchase, what you need, and how to decide what to take? Well, one thing that I recently read, and this was in the March 2015 issue of Outdoor Life, written by Rod Elm, is he seems to have a really common sense approach, I think, to that survival gear. And Rod uses a 3-tier approach. So tier 1 includes the gear that is always on you, on your person, worn or in your pockets. So the critical pieces of gear that can start a fire and signal for help, primarily. And so in that first tier, which I'm implementing his system, includes paracord that you could then braid into a lanyard or maybe a belt, and attach to that a small flashlight, small knife, something to start a fire as simple as a Bic lighter, a signaling device such as a whistle, and a compass. And then in your pockets, you would have an emergency blanket, a small multi-tool, and your cell phone. Tier 1, you've always got it on your body. You've always got that gear that you would most likely need to use as a first level of survival. Second tier, then, are things that you could wear or have in a small fanny pack that you wear or a small backpack. This includes a small first aid kit, a large trash bag, some signal tape, some duct tape, granola or protein bar. Things that you would need if you're going to be out there for just a little bit longer, to treat a wound, more signaling, and even build a small shelter or a simple shelter of some kind. Then his third tier are things that you would have in your main backpack or a larger backpack, and this would include things like a small collapsible compressible sleeping bag, maybe MREs, your water container, appropriate additional layers of clothing, and things like that for a longer trip or a longer stay in the wilderness. So again, I really like this approach that Rod Elm has. If you get a chance, look it up in the March 2015 issue of Outdoor Life. When it comes to first aid kits, there's a lot to pick from out there. From the small pack that you might have in the second tier of Rod's system, to a large pack that you might have in your vehicle or back at base camp. In the small pack, I'm just going to keep things that I'm going to use to deal with a bleeding type injury. Band-aids, gauze roll. Basic things that you'll need most often and don't take up too much room. Then you have the first aid kit that most of you may have around the house or in your boat, in your vehicle. These kits can be found at your drugstore, your Walmart, your other discount center. And they're going to have a little bit of everything that you might need to take care of just about anything. You need to check expiration dates. Usually, the only thing that's going to expire in your first aid kits are going to be the medications. So check those periodically for expiration dates if you're going to keep medications in your first aid kit. The dry items, the gauzes, the Band-Aids, the gauze rolls, things like that, they're typically going to be okay as long as they're not opened and they don't show any signs of water damage. I'm not a big fan of keeping medications in my first aid kit. I would tend to keep medications in my toiletry items or in my suitcase if I'm going on a long trip. They're not really a first line of treatment as a first aid. So in the longer trips, I'd take a few things, but I would keep them separate from my basic first aid supplies. The only medication that I do keep in my first aid kit is aspirin, and I'll explain why in a little bit. Then to the larger pack that we have in our vehicles and out here in our Ranger vehicle. This pack is an EMS pack from Plano. It's the smaller of the two different packs. My husband has a larger pack. This one has a box on top, kind of a quick grab, the things that you're going to need the most often. Again, bleeding type injuries is what I have in there. Inside are several more of those packs. Nice that they're all separate and that you can just grab what you need, organized by, again, maybe different types of injury. Also like that they're separate so that if you're out in the elements and it's raining, you're not going to have everything get wet and damaged. Everything else is protected. This kit also has a convenient pouch for gloves so that if you're helping treat someone who's maybe not a family member, that you can protect yourself and be wearing gloves when you're dealing with any blood or body fluids. Lastly, you need to learn some basic first aid and to be able to recognize some pretty important medical emergencies. Know the signs of a heart attack. Typical signs include chest pain, pain maybe radiating down an arm, maybe pain radiating up the neck, nausea, maybe sweating, heartache. A heart attack rather can also have more subtle signs, but those are the typical signs. Don't mistake it for indigestion. Heart attack, in addition to calling 911 right away, another treatment if the person is not allergic to aspirin or have any history of a bleeding disorder would be to give the person an aspirin. That is why I would keep aspirin in a first aid kit. Also know the signs of stroke. These can be remembered by using the acronym FAST. F for facial drooping. A, arm weakness, usually on one side of the body. S for slurred speech or speech difficulty. And T stands for time to call 911. I also recommend that you would learn first aid by taking a first aid class. Go to your local hospital, your technical college, or emergency medical services in your area to find a class near you. If you're in the Dodgeville area, you can also come visit me September 25th at 10 a.m. at the ADRC Health and Wellness Fair, where I'll be giving a first aid seminar for outdoorsmen and hunters. In addition to being a part of the ADRC Wellness Fair, my organization, Upland Hills Health, has also put together a web page specifically for hunters, and it includes a lot of resources on prevention, including hearing safety, eye safety, footwear, how to get started exercising, seeking a physician's opinion, getting a physical before the season starts, things like that. The website is www.uplandhillshealth.org/healthyhunting. That's it for today, and have a safe hunting season this year.
Thank you for watching. I hope you enjoyed it. For more news and upcoming events, please check out artheloutdoors.com.
You can also find us on Facebook and Twitter. That's a great place to ask us questions, share your experiences, and find out what we're up to. We want to hear from you.